Well, welcome everyone to our webinar on exercise-based MSD prevention programs, development of a daily movement practice strategy to facilitate implementation and sustainability. I'm Catherine Brookman, Associate Director, Knowledge Transfer and Exchange. And on behalf of Dr. Jack Callahan, Director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, or CRE-MSD as we are more commonly known, we'd like to thank you for joining us for this free webinar, especially on a Friday afternoon before the long weekend. We're grateful to the Ministry of Labor for our funding, which supports the delivery of these webinars, and to our presenters who provide their expertise. This webinar is part of the Community of Practice for Client-Patient Handling that we work with in collaboration with Public Services Health and Safety Association, and we encourage you to let your colleagues know about these free webinars. The format of the webinar is as follows. The presentation will be given, after which 10 to 15 minutes will be opened up for questions. We ask that you type your questions into the chat box, and I will relay these questions to our presenters. Should you have a question that cannot wait or precludes you from understanding the webinar, or there's something going on with your audio, please type that in and we will do our best to troubleshoot with you. Should we not be able to get to all your questions today, you are certainly welcome to email us and we will relay those questions to the presenters. This presentation is being recorded and the presentation slides will be available shortly after the webinar. Immediately following the presentation, you'll receive an evaluation, and we encourage you to complete it to assist us in the future delivery and planning of our webinars. Now, it's my pleasure to introduce our two presenters and tell you a little bit about them. So this webinar is back for a second time by popular demand, and it speaks to the ability of our presenters to provide you some amazing information. Our first of the two that I will introduce to you is Dr. David Frost. He's an assistant professor at the University of Toronto in the Faculty of Kinesiology and Physical Education. He completed his undergraduate degrees in electrical engineering and health studies and physical education at Queen's University before he went on to complete his master's in sports biomechanics at Edith Cowan University. He completed his doctorate in biomechanics at the University of Waterloo. His interests include sport, exercise, and occupational biomechanics, evaluation, acute and long-term care, adaptations to exercise, and firefighter wellness and fitness. He is a researcher in the University of Toronto's Musculoskeletal Biomechanics and Injury Prevention Lab. He is also a registered kinesiologist. Next, we have Dr. Tyson Beach, an assistant professor in the Faculty of Kinesiology and Physical Education at the University of Toronto, where he holds an appointment in the Graduate Department of Exercise Sciences. In addition to his teaching and mentoring roles, Tyson directs the research conducted in the Musculoskeletal Biomechanics and Injury Prevention Laboratory. An overarching aim of his research program is to develop and devise tools and techniques to enhance and maintain the capacity of the musculoskeletal system to withstand physical demands of work and sport. His current research projects are focused on the development of sustainable exercise-based performance enhancement and injury prevention strategies for individuals who engage in non-modifiable, unpredictable, and physically demanding activities. So without further ado, I hand this presentation over to our presenters. Thank you.
All right, great. I really appreciate the introduction. Just a thank you to CRE-MSD and then everybody on the webinar at the moment. I appreciate you spending about an hour with us. So just to start, for the past 10 years or so, Tyson and I have been working with various occupational groups, really with the intent to target this MSD issue. And we realize that there are unique demands in every organization, but what we've tried to do is really look at some of the common underlying themes, the guiding principles that really could be applied to all organizations. And we've really kind of gravitated to this idea that exercise can perhaps be reimagined and used as a very interesting tool to prevent some of the injuries that are taking place. And so what we'd like to do today is give you guys a bit of a framework to use a similar approach in your own organization. And we'll use a lot of the work that we've done with the fire service as a model. But I really encourage everyone, and we'll do the best that we can, to really try and think about how the principles that we're speaking to apply to your workplace. So just to get started, like I said, about 10 years ago when we got started with the fire service, one of the first things that we did, as I'm sure everybody on the call does, is really try and assess or understand the demands of the occupation. And it's looking at what are the activities that are involved, the intensities, it's the demands analysis. And we realized that while that provided a lot of valuable information, if we were going in and really trying to make a difference with the fire service, the feedback we were getting was that wasn't sufficient. And so it wasn't until we really started to speak to the actual firefighters, the workers, and understand that the job wasn't necessarily the most important thing to them. It wasn't until we started to have conversations and really try and understand their wants and their needs that we realized that a lot of the firefighters were actually interested in life outside the job. And so if we were going in and trying to essentially sell an injury prevention program, we really had to understand what they wanted out of a program like this. And so while the job was important, it was also what we were hearing was it was also important to address some of the other needs that they had, when they go home, some of the recreational factors. And then this was one of the biggest ones. And so it was, I need to see that whatever we're doing from an intervention standpoint, I need to see an impact on my life at home. It is about family. It is about, looking into the future, longevity, durability, retirement. So anything that we're putting together at the moment, yes, it has to make me healthier and safer at work, but I also want to see the impact elsewhere. And this was it was really important for us, and I think it's probably important for any organization that it highlights that the message or the messaging that we use to try and get buy-in from the workers is going to be dependent on oftentimes the perception of the workers and what they want. And so it can't just be, or we've realized it can't just be a top-down approach where we say this is what you need, therefore this is what you do. It needs to be collaborative. It needs to involve the actual workers so we understand what's actually important to them. And so this just kind of highlights that I think everybody in the workplace, when they are choosing to either get involved or not get involved in some type of interventions that's being done, they're really asking the question, what's in it for me? And so we as a group that is coming in and trying to actually have an impact, we really need to do everything that we can to understand the needs and wants of those involved and realize that there is going to be some diversity in the workplace. And so we might be brought in, and Tyson and I have been brought in to target an MSD prevention issue or like spark an MSD prevention initiative. But we also have to really do everything that we can to understand what that means to all the different workers. And so just some data that we've collected from the fire service. So this is from a large department, about 450 workers involved in this project. And we wanted to know what is their view of health and safety. And so when you hear about a health and safety initiative, what are the things that you actually want to see an impact on or an impact with? And the overwhelming response of the majority of the firefighters in this case, they said that preventing injuries was the number one piece to them. And it was, I need to see impact in my life outside of work. And so it was very telling for us, so that we needed to realize that both in the design of the intervention, the implementation of the intervention, but also, just in terms of how we're selling and promoting this, we really have to emphasize the impact on injuries, but not just at work. And so we needed to highlight how impactful what we're doing and what the intervention that we're putting together, how it can actually impact life outside the job. And so when we started to do this, we did see a bit of a change in the attitude and the buy-in from the firefighters that were sitting in front of us. But just one other piece that I think it's important to highlight, while the majority did say injury and life, it's important to realize that not everybody said that. And so if we do cater all messaging to injury and all messaging to life, we might be disregarding a lot of the really valuable information that's come from the other employees. And so we need to, as we're putting together any type of intervention, realize that there is diversity. And so the underlying principles for the programs that Tyson and I have put together don't necessarily change for the diversity in the group, but the messaging that we might use does. And so realizing that performance is important, preventing disease is important, health and safety at work is important for some of these people. We need to make sure that we're highlighting how what we're putting together also will impact them. And so I think that's something that we've definitely seen over the course of the last 10 years, and it's probably been one of the biggest factors that we would attribute to the successes that we have had, is really trying to appreciate the needs and the wants of all those involved and making sure that the programs we put together are built on kind of a framework that is applicable to all these different needs and all these different wants. So we're all here to talk about injuries, and I think it's a big factor. And as we saw with our firefighters, 50% are saying that is the most important thing. So if we're going to go down the road of really trying to figure out how do we tackle this problem, I think it's important just to address a couple things that we feel are important and the research says are important from how do they actually happen. So just a simple picture, we show this just to highlight two different lifting styles. And often when we pose questions to an audience and ask which is a safer lifting posture, lifting style, some crowds immediately go to the left. And because the individual is lifting with his knees, that this is going to be a healthier, safer posture. But when we actually look at the underlying mechanisms of the injuries that are being sustained, and with lifting, it's largely a back thing. When we understand the mechanisms of the back injuries that are being sustained, we can say with some certainty that the individual on the right is probably adopting a much safer lifting posture, because there's a very big difference between the curvature of our spines and the angle of our trunk, or the forward lean of our trunk. And so we have to make sure that the interventions that we're putting together are actually addressing the mechanisms of the injuries responsible for some of the issues that we're seeing. And so both the education that's put together, the practical hands-on workshops that are put together, again, we need to be targeting mechanisms. So that's one of the things that we think is important in both designing and implementing these interventions. The second piece, so this is some other work that we did with a group of firefighters. We felt that if we're going in and being asked to help prevent the injuries that are being sustained, whether it's to reduce dollars or improve quality of life, productivity in the workplace, we need to understand a little bit more about the injuries that are being sustained. And so this was over a 5-year span with a fairly large-sized department, and we wanted to categorize the injuries by body part. And so we went in and found that over a 5-year span, the biggest 3 injuries were knees, backs, and shoulders. And that might be similar to what you guys see in your organizations. It is pretty similar to what we see with the general population. Knees, backs, and shoulders are typically the big 3 joints that are being injured. But we didn't feel that that was enough to really guide us into developing a injury prevention program or any type of resources that could support this. And so we actually went one step farther and tried to categorize the injuries that were being sustained by the motion patterns that were being used during the activities that were cited as the injury-causing event. And so very interesting to us was that over a 5-year span, looking at all the low back injuries that were sustained, irrespective of job duty. So whether it was attending a fire, cleaning the truck at the station, attending to a medical call, lifting up a patient, didn't matter. 70% of all the low back injuries that were sustained were lifting and squatting related. We found that over the 5-year span of all the knee injuries that were sustained, 81% were related to lunging and stepping. And 99% of all the shoulder injuries sustained over a 5-year span were related to pushing and pulling. And this was very telling to us, and very impactful, because what it said is that the job duty didn't matter. It didn't matter where the firefighters were. It mattered what they were doing or how they were moving or what the movement pattern was that was being used when they actually got hurt. And it also says, or kind of led us to think that maybe if we focus on teaching people how to lift, if we focus on teaching them how to lunge, if we focus on teaching them how to push and pull, and we change these habits or these behaviors, maybe we don't have to go into every single job task they're ever going to perform and teach them how to perform that specific task. Maybe we could teach them the general pattern of lifting and pushing and pulling, and that would then transfer to all the things they do. And so this was, quite appealing to us. And then we thought, okay, well, maybe exercise is one of those environments, one of those tools that a lot of these workers are already involved in, that we could actually use to change their behaviors or change their movement habits, so that we start to see a reduction in some of these injuries that are being sustained. And so the premise here is that if in a training environment or in an exercise environment, we focus on some key things that are going to be important, and we try and stabilize or ingrain these key features, as we'll call them, and we'll highlight 7 that we've come up with in a few minutes. But if we stabilize these key features in an exercise or training environment, the idea is that they're going to emerge when it really matters. And so the idea isn't to get people better at exercise. The idea is to use exercise as a tool to really ingrain these key features, and these key movement patterns that we know are going to be relevant in the things that are actually important. And this is work, this is life, this is sport, this is wherever. So if we can use exercise to actually change the behaviors of the workers, then we might start to see a reduction in the injuries that are being sustained. And if we don't do that, so if we are exercising, and a lot of our workers are being physically active in some way, whether it's in an exercise environment or not, but if we end up rehearsing or reinforcing some of these undesirable features, unknowingly perhaps, then it shouldn't be a surprise that we start to see these same patterns or these same habits emerge when it's really important. And so, we've all probably heard the phrase of practice makes perfect. But practice doesn't really make perfect. Practice makes permanent. And so if we continue to reinforce something that isn't desirable, then it will tend to appear when it really matters. And so we, again, think that exercise can be used to really ingrain some of the stuff that we know is important from a research perspective. So that's, from an injury standpoint, that these are some of the things that we're thinking about when putting together the exercise initiatives that we have used to work with various populations. So the next piece is, what information do we actually need beyond what we just talked about to actually put together an MSD prevention program? And so I think that the list here, this is something that we've used in the fire service, but I would encourage everybody on the webinar to really reflect on the organizational needs that you have in your own workplace. Because what we've also found is that implementation is extremely important. And so if we just identify or think about, how injuries happen and what has to happen from a prevention standpoint to reduce the injuries from being sustained, but don't think about the logistics of what your organization looks like, then it's going to be very challenging to actually see progress. And so in the fire service, in addition to, again, understanding the mechanisms of the injuries and thinking about what an exercise program initiative look like, we're thinking about what type of support do we have from management? What type of support do we have from the workers? Is there actually interest? Is there money for something like this? Are there equipment? Are there facilities? How many workers do we actually have? What is the actual culture in this organization? And so all these different factors are going to influence both the design and the implementation of some type of initiative that we're putting together. And so I can't overemphasize how important it is to gather this type of information. And so again, as I would encourage you guys, as you're moving forwards with the creation of something in your own workplace, really reflect on what your organizational needs do look like. So the model that we've taken with our firefighters is that we also want to empower the actual workers. And so we don't necessarily want it to always be a top-down approach. And so what we've done is create a lot of practical workshops, activities, created some resources to support the implementation of these programs. But we want the firefighters or the workers involved in the process. And so it really has become a bit of a peer-to-peer model where we're teaching firefighters who can then become ambassadors or advocates for this type of thing in the workplace. And we really do feel that this has been a successful approach, because now it's not just providing the education, but it really is empowering the workers to kind of take control over the things that they feel are important to them. So that's the approach that we've taken. So all this said, so what we do, so when we're thinking about how do we actually start? So it's great, we're saying exercise can be used. We have to understand all the different needs and the wants. Where do we start, and how do we make this relevant to every individual involved? And so one of the kind of the foundational pieces of our programs, it's really looking at the demands of the workers. So essentially, where do you want or need to be today? And so what are your demands? And really, every single person on the call has demands in their lives. These are the activities that you're involved in at work, at home. It's all that stuff you need to do. And really, the question becomes, what is the capacity that you have to perform those things? And so the approach that we've taken is let's try and understand the demands of the individuals or the workers, and then try and understand what capacity do they actually have to do that. And so that's their abilities, it's their awareness, it's their understanding, it's their motivation. But it really gives us some insight into where they are now. And then so the programs that we put together are trying, the intent is to balance demands and capacity. And so we want to make sure that what we're putting together, and this is one of the reasons why we use exercise, is we really feel that exercise provides some very unique opportunities to build the capacity of the workers so they can continue to handle the demands that they have. And so, as I mentioned, I think it's really important to, again, highlight that when we're trying to assess the demands of the individuals we're working with, that we don't just focus on the workplace. Because the individual, one, they might have something that they do outside the job that they view as really important, but those activities that they perform outside of the workplace might also impose higher physical demands. And so if we don't appreciate the higher physical demands that they might be experiencing outside of the workplace, then the initiatives that we're putting together are not building their capacity to a sufficient level. So we have to make sure, again, that we understand the demands so that we can build your capacity to the extent that we actually need to for you. So how do we actually go about doing this? One of the things from a capacity standpoint that we found, and the research would support this, is that there are key movement patterns, or what we've termed key features, that are going to be relevant to help prevent injuries, to improve performance, its quality of life. And so we've identified 7. And so we're promoting these 7 key features for anyone. So this could be kids, this could be firefighters, this could be any type of manual material handlers. But there are 7 key features that we feel need to be emphasized in an exercise environment. And so what these are is it's knees, backs, and shoulders. So the big 3 injuries that we saw being sustained were knees, back, shoulders. And so now we're addressing some of these specific mechanisms that are responsible for the injuries. But we're trying to emphasize control of these key features in a training environment. And so it's controlling the knees, keeping them in line with the hips and the feet. It's keeping your back straight, so not trying to ingrain a pattern that doesn't adopt spine flexion, and keeping the shoulders back and down. And so these are things that we're emphasizing in the training environment, regardless of the exercise or the activity that's being performed. The other thing that we also realize is that that's not enough. If we're trying to prevent injuries, we know that fitness is also important. And so if we're lifting heavy things frequently throughout a day, we have to make sure that the workers have sufficient fitness, strength, or endurance to actually support that. And so what we're trying to do when we build capacity is, yes, we want to control these motions that I mentioned before, but we want to do so within the context of an extended duration or an elevated load, if that is relevant to the individual or the workers that we're working with. And so the video here is just it's something that we've done with the firefighters, both to highlight the importance of fitness, but also emphasizing, so that we use this as an educational tool. So we had a group of firefighters standing around watching, and what we've done is put 2 pieces of orange tape on the individual's back to highlight that when they're lifting, we don't want those 2 orange pieces of tape to get any further apart. And so if they got farther apart, that's indicative of the spine being flexed, which we know is going to be something that contributes to their risk for injury. And so we want those 2 orange lines when they're lifting, or we highlight for everybody else that as you watch this individual lift, just look at the 2 pieces of orange tape. And so from an exercise environment, we would try and elevate loads or extend durations of the activity while the worker was maintaining those key features, or in this case, maintaining those 2 lines the same distance apart. And so, but we also have found over time is that movement really is a behavior. And what I mean by that is that movement is really context dependent. And so how you move in one environment may not necessarily be how you move in another environment. But there might be some common things with that behavior that you're exhibiting that we can assess for. And so as we're building the assessment, as we're structuring the design of an exercise program for you, it really is trying to look at what are some of those things that we can capture and identify what needs do you have. So with this whole idea, we really need a process to identify some mobility needs and some control needs. And so I'll walk through what we're doing and a bit of a process or a framework that everybody on the call can actually use in their organization. Oops. So if we take 2 individuals here, the individual on the left, they're both doing an overhead squat. So we look at the individual on the left, and I think there is a tendency to look at this person and make an assumption about the mobility that they have at the ankle. So it could be that their ankle is restricted, therefore they're not getting as low as the individual on the right. Or there's some type of restriction in the hips or the hamstrings are tight, therefore they can't, get quite as low as the individual on the right. Or maybe we say the same thing about the shoulder. But knowing that movement is behavioral and really context dependent, we have to be somewhat cautious about making any assumptions based on visual observation alone. And so if we look at the individual on the left, yes, his ankle, his hip, and his shoulder mobility might actually be limiting, but it also could be his perception of instructions. It could be his strength. It could be his coordination. It could be his awareness. There are a whole host of things that could actually be influencing how he's moving. And so we can't necessarily say with any certainty that yes, he does have a mobility issue. But if we look at the individual on the right, if he's squatting a little bit lower, his knees are further forwards, his hands are being kept above his head, when we look at this individual, he's demonstrating that physically he can adopt a particular position. And so there might be something to be said that about this individual doesn't actually have a mobility issue. So if you can physically put yourself in a particular position, you're really telling an observer that your joint is not limited by a particular range. And so we think that when assessing the needs of the workers that we're working with, rather than trying to diagnose based on visual observations, we might, and trying to say this is what's wrong, we might be able to actually use various tools to say this is what's going right. And if we start to rule out things that are actually going well, we might get closer to the truth of what your needs actually are. So this individual on the left may not actually have any ankle, hip, or shoulder mobility needs. It might be something else. But we can say that the individual on the right doesn't have those needs. And so this is a bit of the approach that we've taken when designing our exercise programs. And we'll give you guys a couple practical examples of that in a sec. So very broadly, if we're thinking about trying to identify needs of our workers, we can think about 3 different categories of people. And so if we go back to the individuals in this slide, we take the individual on the left. We can't say that he has exceptional mobility to perform his tasks. And so this individual would fall as worker number 3. So we're not quite sure about his mobility at this point. And because we don't know about his mobility, he's not showing us that he has that, we're not quite sure how he can control his back or how he can control his knees or his shoulders either. The individual on the right, we can say with some certainty that this individual has mobility at those three joints. So ankles, hips, and shoulders. We could also say that he's able to control motion of his back, control motion of his knees, and control motion of his shoulders. So if we were categorizing him, we would say he falls more similar to worker one. But then there's also going to be people, if we go back to this individual here, maybe the individual on the left does have great ankle, hip, and shoulder mobility. He just can't access it, or he just can't use it. He doesn't know how to have or to use the mobility that he has. And so that requires a very different intervention than somebody that has a mobility need. And so what we're essentially trying to do is categorize our workers as one of these three people. People that don't have mobility needs and can control their body really well. People that have no mobility needs but can't control their body, so they don't necessarily know how to move in a safe and an effective manner. And then the third one is those individuals that need additional mobility. And what we're essentially saying is that if you don't have the mobility to put yourself in a particular position, it doesn't matter how aware you are, it doesn't matter how much training you get from an education standpoint, you're never going to be able to adopt those healthy and safe positions that we know are important in the workplace. And so we would need to improve your mobility before we can actually pile on some of this other stuff. The individual that has mobility that can't use it, that requires another different intervention. Stretching you out and giving you more mobility isn't going to help you. We actually have to put together an intervention that is going to address your specific needs. We need to teach you how to move. We need to teach you how to become more aware. And so based on which category you fall into, that's going to dictate what you do and what you need to actually improve your health and safety in the workplace and at home for that matter. So this is the process that we've come up with. So as a first step with everybody, we can actually take you through a simplified movement screen to try and understand what your mobility needs are. And essentially that means that we're looking to see, can you put yourself in certain positions actively? So do you have the active mobility to adopt these positions? If you do, and you can control yourself, that tells us that, again, that you're going to fall into that category one. If we still don't know with any certainty that we can rule out mobility issues after taking you through that screen, we're going to follow up with a passive range of motion test. We want to know whether you couldn't put yourself in those positions because of a mobility need or because of a control or awareness need. And then after that, we'll follow up with something else to see where you are. But just as a kind of an example of this, and this is something that everybody can try at home to try and rule out, say, hip mobility. And so we would have you do a body weight squat. You can see the individual here has those two lines on his back. We're looking for a parallel depth and keeping those two lines the same distance apart the entire time. First time, try it with your heels down. Next time, try it with your heels up. Either way, if you can get to parallel while keeping those two lines on your back the same distance apart, we're going to rule out hip mobility as a problem and say you don't need to work on your hip mobility to help with squatting or lifting mechanics. So this is just a sample example of something, a very practical tool that we are using at the moment. And so this is just, we do have tools available to keep track of all this. And I think in the handout that we're making available, you guys will have access to this as well. So you can kind of see what the criteria are and how we go about actually conducting this type of assessment. As the second step, as I mentioned, so if we can't rule out mobility with that movement screen, we're going to follow up with a passive range of motion test. And we actually have tools available to look at hips, to look at shoulders, to look at ankles that will help to identify an actual issue. And again, the goal here is to try and identify the needs of the workers. So that's, again, the goal. We're trying to make sure that we know everybody's very time limited. We want people working on the things that are going to be important and relevant to them. And so this second attempt here is really looking at, do you have mobility needs? Do you have sufficient range of motion to perform the tasks that are relevant to you both at work and at home? So that was our second attempt. And again, just an example here. So we have some tools available that we're looking. So this is an active test, but we would be doing it passively to try and rule out mobility for the hip, the shoulder, or the ankle. And again, same sheet, so you guys will have access to this just to see what the criteria are that we're using to rule out these different things. As a last piece, because as I mentioned before, fitness is important. So there's going to be a load for every single person on the call that if you try and lift it up, you might be forced to round your back. And so we want to know what that is. And is that, do you have sufficient fitness, or do you have sufficient capacity to actually meet the demands that you have in the workplace or outside the workplace? And so just looking at your mobility and just having you do a movement screen isn't sufficient to tell us what your actual needs are. And so we would follow up with an additional an assessment that was relevant to the demands that you have to actually figure out, where do you actually lose control of your back? Do you lose control of your knees? Or do you lose control of your shoulders? Again, with the sole intent to identify specific things that you can work on to build your capacity so you can continue to do all the things that you need or want to do. And again, so there's resources available to both assess this, track this in the workplace. So we have this available as well. So from this, again, the goal is to very broadly categorize our workers into one of these three groups. The one group, like I said, no mobility issues, and they have control of those important motions that are relevant to them. So for that individual, we will be looking to build capacity. So we're going to be looking to increase your strength, endurance, and awareness that within the context that would be relevant to your job or relevant to your life. The second individual, this is the person that we found that they have the mobility. So we tested them passively, and their joints can't actually go through those ranges of motion, but they can't control it. And so this is the person that has great hip mobility, but whenever they go to lift something, they're frequently rounding their back. We need to improve that individual's control. We need to make them more aware of how they're moving, so that they don't put themselves at risk when it really matters. And then the third individual, this is the individual that could be super aware. They have lots of control within a very limited range of motion, but they've also shown us that their joints can't actually physically get into those positions that are important right now. And so before we start piling on a whole bunch of other stuff for this person, we need to work on their mobility. We need to give them the opportunity to put themselves into these safe positions so that we can then build on them from there. So these are the different needs that we can identify with the process that we've taken them through up to this point. Then, as I mentioned, it comes to the point where we actually have to use this information now. And so it's, what does the design of an intervention actually look like to address these three different categories of workers? And we think that exercise can really be that tool to help us get there. And so I like to use this slide just to highlight the importance of the fact that movement matters. And so we take the individuals on the left side of the screen versus the individuals on the right side of the screen. They're both doing the same task or same activity, but they're performing in very different ways. And so it really isn't about just the exercise or activity that we're doing, it's how we do the exercise. And so we really need to be aware that we've identified these specific needs and we can provide various tools to help with that, but it's becoming cognizant of what actually matters when performing the activity. As I mentioned before, it's the practice making permanent. We have to make sure that we're reinforcing the patterns of the key features that we know are important from an injury standpoint. And so again, if we look at the individuals here, there are some that would be adopting those things and there are others that don't. So we have to make sure that when we are exercising, when we are implementing this type of program, that an emphasis is placed on how we're moving. So we've identified three categories of needs or interests, things that we can focus on from a design standpoint. And just as an example, if we're working with the individuals that need mobility, whether ankle, hip, or shoulder, we really do feel that just 5 minutes of daily activity or exercise on a regular basis can really make a big difference. And so we really think that exercise shouldn't be viewed as this big thing that is daunting and has to be extremely hard for people. We really do think that with very limited time, very limited pieces of equipment, we can actually address the needs that people have to make them safer, improve quality of life, improve performance, and all these things. So just as an example, somebody that's been identified as having a mobility need, these are 2 5-minute activities that could be used to actually address that. This is something that could be done on a break in the workplace. This is something that could be done at home. And it really does highlight the fact that if we can improve this individual's mobility, it's going to have an impact on what they do at work. It's going to impact on what they do at home. And so what we've done in trying to message and sell these programs, this little daily movement practice idea is relevant to everybody. So it doesn't matter who you are and what you have identified as being important. There are things that we can do in 5 minutes every single day that can have a massive impact on your life. And again, so if it's not mobility, we can do the same thing for improving control of low back, your knees, your shoulders. But again, it's really identifying what are those things that were important and how could we actually structure something in 5 minutes to see a difference. And then lastly, again, from a fitness standpoint, we're looking to build capacity within a context that will be relevant to this individual's life. So again, as I mentioned, we feel that prioritizing implementation is absolutely critical. And so when you are building a program and you're thinking about the needs of your workplace or the needs of your workers, we really do feel that buy-in is the #1 piece. And so if you don't have people buying in to what the program is, or going back to that messaging, it's going to be very hard to see any type of change. And so we've adopted a bit of approach that, we have to inspire people to get involved, really change their attitude towards what this health and safety thing is all about. And so that involves small steps. It really involves highlighting the impact, not just at work, but also outside of work, and really embracing that diversity that you have in the workplace. So the initiative shouldn't necessarily cater to any one group of individuals, but it really is trying to understand the needs of all involved, so they can kind of all get into the same piece. After we've got a little bit of buy-in, it really is looking at what are some of the evidence-informed practices available, or the information that is available, so we can start changing perceptions. This ties into the idea of the lifting with your legs and not with your back, and perhaps lifting with a forward lean might actually be more effective than trying to bend your knees all the time and lift with an upright trunk. And so really looking at the evidence to say, what are some of the strategies that do work? What does target the mechanisms of the injuries that are being sustained? And with this, I think that we can try and empower some of the workers so that we do have ambassadors from the actual workforce that are pushing this program forwards as well. That leads into really trying to empower, give some ownership over the program to the workers, so it isn't always a top-down approach, and highlighting the importance of deliberate practice. And if we can become somewhat cognizant of the things that are important, and we do try and reinforce some of these key features over time, that will lead to behavioral changes in all the different activities that are relevant to our own lives. And we really do feel that challenging the workers, with in various ways, will help to build a sense of community, and it can change the culture and the mindset around health and safety in the workplace. So with that, that's the conclusion of our presentation, and we can open up the floor to any questions you guys have.
Well, thank you very, very much, Dave and Tyson, for a very informative, encouraging presentation. I think it's so much less daunting for everyone to think that just 5 minutes of exercise a day can make a difference in our physical performance. And I'm sure we'll have questions about how people can access either one of you, or how to introduce this concept into their workplace. So as we have time now, we would like to invite you to type in your questions into the chat box, and then our presenters will have an opportunity to engage in discussion with you. While we're waiting for questions, Dave or Tyson, did you want to just comment on if you get approached to come to different organizations? And if you have, how do you handle that?
Can you repeat the question?
If you get approached by organizations to come in, talk about how to assess for physical fitness or physical capabilities of individuals to do the job, how are you able to go into companies and do that? Or, how do you handle those kind of requests?
Yeah, I think that we do get those requests, and I really think that the first step that we would take is to, like I mentioned, it's really trying to understand the needs of everybody involved. Um, and, just in the past, if we're approached by administration, they may have certain needs, but some of the questions that we have are, we'll need to speak to the workers to really understand their perceptions as well. Because it's important for us to make sure that the workers know that as we're coming in, they realize that this isn't just a management approach. So as an example of that, so this is some more work with the fire service, but we were approached by a department from the management side, and we said, okay, we love to work with your group, but before we do that, we want to run a bit of a project where we'll show up, every single Saturday to do a health and safety workshop with your members, but we don't want them to know why we're there. And so I showed up every single Saturday, and there were about 50 firefighters that would come to this workshop, and all they were told was this is going to be a health and safety thing. And before I told them who I was and what we were trying to do, I said, I want you guys just to be completely open, completely honest, and let me know or tell me what you think about health and safety, or tell me what you think about some of the initiatives that have been done in the department. And so it was a very eye-opening experience for me because they didn't know who I was and what I was, there to do. They essentially let me have it, and they told me how they hate everything that's done, and they were very candid with their views on, what's been done with the department and how they perceive health and safety. And so that was very important because it really told me what their current attitude was. And so if I had only ever heard from management, I would have thought, things are great. And this is what we should be doing. But when I heard from the workers and a very raw interpretation from the workers, it really gave me a much better sense of what needed to be done in that department. And so part of the intent with that is to not only get a sense of what their attitudes were and what their perceptions were, but it was, can I then take, knowing all this diversity, can I within 2 hours, so I administered a workshop, a very hands-on workshop with these groups as well. So within 2 hours, knowing the diversity in the group, can I change their attitude towards health and safety? Can I get everybody to buy into some of the initiatives they're put together? And in just 2 hours, so about half of the individuals beforehand, so we had about 500 people go through this little project. Half of them were completely disinterested and a bit jaded towards health and safety. After 2 hours, I think 94% of them said that they were more motivated to be healthier and safer at work. And so my point with all of this is it's really taking the time. So when we're approached, it's really taking the time to understand the needs of everybody involved, appreciate the diversity in the group, but realize that messaging is extremely important. And there is a lot that can be done in a very short period of time to get everybody on the same page. But it starts with really trying to understand and appreciate the needs and the wants of those involved.
Thank you.
So long-winded question to your answer.
Thank you very much. So we've got some great questions flowing in, and I'll try and get to as many as I can. When you've presented at employer workplaces, do you know if there are some employees that are trained to do an assessment for their coworkers? And if so, are you able to prescribe a very simple exercise plan for them, for their workers?
Yeah, that's a really good question. So we didn't talk a lot about the way that we implement and deliver. So a lot of the work that we've been doing is on the education front. So in the fire service, we find a peer-to-peer model works really, really well. So it's great. So a lot of the people that we, engage with in that capacity. They do have some background, but a lot of them don't either. So you'll notice with our tools, we try to make these accessible to people without a lot of also kind of, theory and background in the area as well. So when it comes to, if there were people in place that have experience doing this, I think the resources that we've developed, and I just want to highlight, so on the screen right now, what we're trying to do is to try to disseminate some of these materials we've been building with the fire service. So for the person who's asked the question, if they have a background, it'd actually be great to get feedback if you were to go through those materials and to see if that was something that, could work for you. The other thing that we're trying to do, to Dave's point about trying to get, more kind of buy-in and ownership and people, kind of really engaging in the process. We have a vision at some point to try to make these assessments also kind of self-assessments, so things that people can do relatively in a more simple way, and perhaps even privately if that's what they want to do. But and then to be able to provide them with resources. So if they go through this really kind of quick self-assessment, are they able to identify something that they could spend a few minutes on each day? And obviously, when it comes to the prescription side, that's something that we're working on, kind of rolling out materials. So I'm not sure if it exactly answers the question, but I'm happy to follow up if it doesn't.
Okay, thank you. And this is a similar question. What kind of 5-minute fitness exercise do you recommend for PSWs working in long-term care settings?
Well, somewhat, as you probably expect based on what we've been talking about, it would kind of depend a little bit on the needs and the wants of the people. So we obviously, a PSW setting, we understand, the general idea, like the general kind of demands of their work. But we really think it's important to have a bit more context before we would start prescribing specific exercises. And again, that would kind of follow from the assessment. I think one thing that's important for people like PSWs, and we get this question a lot because we work with people who do really hard work. And I think it's important that the point that Dave brought up about we kind of try to redefine almost, and even kind of what we talk about performance, but exercise. So when we say there are things that people can do relatively quickly, we're calling it exercise because it's really structured and individualized for the people. So it's not something just kind of randomly done. But it doesn't have to be something extremely physically demanding either, especially for people, that do hard work. So I know that's a really roundabout way. It's hard for us to give specifics without knowing more context, but that really kind of all emerges and kind of follows from the assessment process.
Just to build on that too, I think that what we do have are various of these 5-minute little activities that kind of cater to those 3 different categories. And so as an individual worker, there could be resources available to you, so you can choose whatever you feel is relevant to you. So it's not to say that we have to assess everybody and everybody needs something specific. It's packaging these things to address a specific need, and then based on the perception of the worker or based on another individual in the workplace, they can say, here's 5 options for you to choose from. And so it does give some ownership to the workers so they have choice in what's actually going on as well.
That's a great comment. So for those PSWs that are needing to strengthen their back because of the client-patient lifting or transferring, certainly having a look at your tools and then following up with you with any questions would probably be a good idea.
And can I follow up, Catherine, just quickly? So this is a really good point you brought up, is that so in a case like that where people, do a lot of manual handling and, it obviously imposes great demands on their back, we like to kind of expand. So the reason we like an exercise environment is because we like to expand the perspective a bit. In our view, in the biomechanics literature, you can really kind of pull this from the literature, is that a lot of times our back ends up being a weak link because a lot of load's been imposed on it because of other issues. So it can even be something just as simple as ankles. We can do all the back training that we want. We can give people really strong backs, but if they really can't bend their ankles, we're never allowing the load to be redistributed. So that's just kind of one point I'd like to make, is that we try to take I think you can probably glean from the presentations Dave delivered, but we try to take a holistic approach and not only just kind of physically, but looking at the bigger picture.
I think that's a really, really excellent comment, and I'm sure that has set many minds aside and racing on having a look at the resources and then thinking about what they can do. We have a question around research. And we only have a few minutes left, but was there anything in the research that surprised you about movement patterns that you found?
I'll comment first. I can see Dave's wheel spinning because Dave's, this is kind of his bread and butter to be able to see. But one thing that surprised me, and this comes if you're speaking more broadly about research, I've worked in a high performance sport environment for a long time. And I'm always continually amazed at when we talk about things like just basic physical literacy, that's something that really strikes me as, people are able to perform really quite admirably, but then don't always have the kind of, I guess, fundamental movement repertoire, or kind of that foundational approach. And it's interesting. We see people who maybe are not as high, in a high performance environment, but some people tend, to have these skills and capabilities more well developed. So I think the variability that we see across many different performance groups and different contexts is something that surprises me. And I think that, even for Dave and I talk about this with ourselves, we've been studying exercise for as long as we've studied anything almost. And there's always something for people to work on. So I think that would be one of the most surprising things to me, is that you can even see professional athletes that could really benefit from taking a look at their foundation.
Just to add on to that piece, I think one of the both surprising but also absolutely fascinating and somewhat promising things to me is how the environment can shape the way people move. And so, a lot of the, things that we talk about in the workplace, it could be adapting an environment to make things healthier, safer, lower risk, but seeing that the individual workers will then adapt their behaviors to accommodate the changes that have been made. And so I think from an exercise environment, it also leads to a whole bunch of different questions and possibilities that perhaps we could structure an environment to elicit a particular movement response from the individual. So we end up, whether you use this as an opportunity to teach them how to move differently or teach themselves how to move differently without actually instructing them. So it could be creating an environment to actually elicit the response you're looking for without them realizing it.
That's a great point. If I could pile on, Dave and I were good. This is so exciting for us now because these are the types of things we're kind of, falling back on fundamental movement theories and this idea about how people interface with the tasks they do and the environments in which they do it. It's such a powerful approach for us to think about how to, not only help people develop the physical, the kind of exercise base, but also for them to kind of adapt their own environment. So we've been thinking a lot about this idea of kind of how we do ergonomics, and as this kind of what we view as a false dichotomy between fitting jobs to workers and fitting workers to jobs, because just changing the way you move really does change the job in of itself. So it's really this kind of really great feedback loop that we can generate by giving people, helping them kind of expand their movement repertoire, giving them capabilities that they didn't have, and we can do that through exercise.
Very, very exciting, and I can see a few spin-off webinars being requested, especially as we work more with nurses and personal support workers around the environment they're working in, how that shapes, in fact, how they're able to move or transfer a client. And so I'm sure there'll be some follow-up with you, Dave and Tyson, on that. And we're out of time today. This was a repeat webinar. I expect we'll have requests again, and we may in fact be able to focus it on one specific topic area that will allow you to address the holistic approach to perhaps assessing or doing a case study and then looking at what modifications would be supported in the environment to enhance performance. So, thank you very much, Dave and Tyson. The last word is yours, and then we will sign off.
I just want to thank everybody again for listening, and please feel free to reach out to both Tyson and I if you do have any other questions. And thank you to CRE-MSD again for hosting.
Our pleasure. Have a great long weekend, everyone. Thank you for joining us today.